George Barker, and Senator Barker represents Virginia's 39th Senate District. The floor is yours.
Thank you very much, George, and thank all of you for being here. For those of you from other parts of the city, I want to welcome you to the 39th District. That's where you are tonight. So, since you're all Democrats, if you all just move into my district, I think we can take care of this election right away here. So, you're all welcome and encouraged to move to the 39th District. As Adam said, there are a lot of issues that we deal with, and there's clearly some challenges we have right now. I can tell you the biggest thing that made a difference last year in handling the budget, and the biggest thing that made the difference is related to the outcome of Medicaid expansion and health care services to lower income people, was the resignation of a Democratic senator from Southwest Virginia that changed us from a situation where we Democrats had the majority in the Senate to where we were in the minority. It's critical that we have that majority back next year, and that will produce long-term benefits. Clearly, the issue that is most likely to be the dominant issue in the legislature next year is the same issue that was the dominant issue last year, and that is health care services for people who don't have health insurance and do not currently qualify for our Medicaid program. In particular, the Medicaid expansion proposal. The majority of states have already moved to expand their Medicaid program, but Virginia has not. We have had lots of states with Republican governors, several of them with Republican legislators who have moved to do it, and yet even with a Democratic governor pushing very hard, and last year we had a Democratic Senate up until the last minute on the handling of the budget, we've not gotten that done. We need to get that done next year. We can get that done, and if we have the majority in the Senate, I do expect we will get that done. Right now we have over 300,000 Virginians who need medical services, need health care, are below 133% of poverty, and do not meet the qualifications for Medicaid. A lot of people assume that if you're poor, you qualify for Medicaid. That's true if you're below the age of 19. That's true if you're above the age of 64 and you have long-term care needs. That's true if you're totally and permanently disabled. But if you're an adult between 19 and 64 who is not totally and permanently disabled, you don't qualify for Medicaid. We need to change that. Medicaid it will be a significant benefit, and study after study has proven it, to those people who do not have health insurance coverage. They already have substantially shorter life expectancy, more illnesses, more health problems, more chronic disease than people who do not. But it's also important because of what it means to our economy. Our economy will be stronger. To our job situation, we will have more jobs providing the care. To the fairness of the people in Virginia who are paying taxes related to the Affordable Care Act, because we are sending $5 million a day and getting very little of that back right now. Finally, it will be valuable to our hospitals and to our healthcare systems, and then to those people who need coverage, who need that service, and who will benefit from Medicaid expansion. That is the dominant issue for next year. Thank you.